Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you the 3 ways on how to turn the tables in your favor and have control, power and influence whilst your loved one is critically ill in intensive care. You can read, watch or listen to the blog by clicking on the link below this video. In this week's blog, I want to show you how believing in yourself will help you to have control, power and influence whilst your loved one is critically ill in intensive care. If your loved one has been admitted to intensive care for critical illness, I bet that fear, frustration, stress, struggle, challenge, the feeling of vulnerability, loss of control, the feeling of powerlessness and the lack of influence are all things you can resonate with. The biggest imprint left on you and your family are probably the lack of control, the lack of power and the lack of influence. Furthermore, with the intensive care team holding all the perceived power whilst your loved one is critically ill in intensive care, you can feel a void and a gap between the perceived power the intensive care team holds and the perceived power you and your family hold whilst your loved one is critically ill in intensive care. Certainly, this power struggle is only perceived, and a lot of it simply depends on your mindset. And if you are like 99% of families of critically ill patients in intensive care, you will simply never have any control, power and influence, because those families simply think that they can't have control, power and influence. Again, their mindset holds them back, and it's easy for the intensive care team to drive their agenda and keep you at arm's length, so to speak. There is very little that you can change in the perceived power dynamics between the intensive care team and you, your family and your critically ill loved one, unless you start with your inner game, so to speak, and with your inner beliefs. The 1% of families of critically ill patients in intensive care who have control, power and influence are able to change the perceived power dynamics between the intensive care team and themselves, because they simply believe that they can. And those interactions between the families who believe that they have control, power and influence and the intensive care team are very different from the start. The intensive care team recognizes your beliefs and your vibe, and they very rarely question those dynamics because they realize that those families simply have control, power and influence. They can feel that it's tangible and that it's real. What's the difference, you may ask? Well, Henry Ford once famously said, "Whether you think you can or you can't, you are absolutely right." The bottom line here is very simple, and if you believe that you have control, power and influence in such a difficult and challenging situation, you simply will have control, power and influence. And if you think that you don't, or that you can't have any control, power and influence in a situation where your behavior and your beliefs can significantly impact your critically ill loved one's outcomes and recovery, you simply won't have any control, power and influence. If you belong to the 99% of families of critically ill patients in intensive care who don't have any power, control and influence, good luck to you. The intensive care team will only tell you half of the truth of what's really happening. And the bottom line is that your critically ill loved one may not get the best possible treatment. I bet if you believe in yourself, the intensive care team will take notice. If you belong to that tiny 1% bracket of families of critically ill patients who do have control, power and influence, your critically ill loved one and the intensive care team will consciously or unconsciously feel the positive vibes and determination coming from you, and I bet that whatever the odds are, you and your family will have a much bigger impact on how the intensive care team treats you, your family, and your critically ill loved one. Don't be paralyzed by fear, frustration, and by the perceived power that the intensive care team holds, and take charge of your beliefs. Often, the only thing you can control in such a difficult and challenging situation are your thoughts and your beliefs. I'll give you a quick real-world example where I have been involved in a few years back. A man in his 70s was once admitted to intensive care with open heart surgery. After the surgery, he had a cardiac arrest, and his heart basically stopped, and he was resuscitated on an open chest for more than 1 hour. He survived, but with a very poor prognosis. This man had previously suffered from a stroke and cancer and survived and recovered from both. On top of that, he had gone into kidney failure and was now dependent on the dialysis machine. The intensive care team was adamant not to continue treatment and tried to convince the family that a withdrawal of treatment and a limitation of treatment was, quote-unquote, in the best interest of their critically ill loved one. In the back of their mind, the intensive care team wanted to free up their ICU bed, and they also thought that this case wasn't a good business case, that wouldn't make them any money, or they would lose money. If the family had been like 99% of the families of critically ill patients in intensive care, they wouldn't have questioned the intensive care team's perception of the situation, and they would have agreed with the intensive care team, with the most likely outcome of their critically ill loved one dying. However, this particular family belonged in the 1% bracket of families of critically ill patients who had control, power, and influence, simply because they believed that they could have control, power, and influence. To cut a long story short, the family of the man in his 70s made very clear that they believed that their husband, father, grandfather, and brother would survive the odds, as he had done many times in the past. This family knew their loved one well, and they wouldn't buy into the strictly clinical and academic opinions the intensive care team held. They followed their beliefs and their gut, and they held lots of power, control, and influence, and the intensive care team knew it, and after initial resistance, the intensive care team would continue treating this man with a good outcome. The man recovered and left intensive care after a few weeks in ICU. Moral of the story: if the intensive care team and your critically ill loved one know that you believe in your ability to come out good from this challenge and difficult situation, they will consciously or unconsciously feel it and know it, and you will be able to have control, power, and influence. Do never give up. Imagine you don't believe that you can have control, power, and influence, and imagine you don't believe that your critically ill loved one can and will recover. What other options do you have? Trust in the intensive care team, who has many other and often competing interests and agendas? I don't think so. You controlling your thoughts and beliefs are often your biggest leverage points, whilst your loved one is critically ill in intensive care. So, how can you further leverage your level of power, influence, and control whilst your loved one is critically ill in intensive care? And how can you be in control of the situation? You'll get to that all-important feeling of power, control, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to control, power, and influence in your situation. You'll get that crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again with another update next week.